Hi, hello, welcome to Dr. Aparna's Healthcare. So today we are going to discuss about the topic cholesterol. So when you hear the term cholesterol, we always think whether the cholesterol is good or cholesterol is bad. The answer is actually cholesterol is not something bad. Cholesterol is essential for several functions of the body like production of certain hormones. It is essential for the absorption of certain vitamins. It is also required for the proper functioning of the cells and tissue of the body. It also helps in the production of bile. So several functions are performed by this cholesterol. But when will this cholesterol create a problem to us? So when the level of the cholesterol is above the required quantity, it can create several health problems. So to understand whether we have the normal cholesterol level or not, we usually advise a lipid profile test to the patient. So this test is usually done on fasting. 7 to 8 hour fasting is required before you do this particular test. And this lipid profile test not only measures the total cholesterol level, but it also measures the different forms of cholesterol like LDL, HDL, triglyceride, VLDL, etc. Today we will be discussing at what level, what increased level should one start taking the medicine for this hypercholesteremia or hyperlipidemia. So to understand that, first we will see what are the normal levels of these different forms of cholesterol. The desirable amount of total cholesterol in the body is 200 mg per dilution, and if it's between 200 to 239, it is considered as high borderline. And when the level is 240 or above, that is when your total cholesterol level is 240 or above, you need to consider taking medicine. You need to consult a doctor and you need to start the medication for it. So as I said previously, there are different other forms of cholesterol. The first one we'll discuss is HDL, that is high density lipoprotein. It is otherwise called as the good cholesterol. So as the name indicates, good cholesterol, this cholesterol helps in removing the other forms of cholesterol, and it also removes the plaque formation, or it prevents the formation of plaque inside the blood vessels. Okay, and one has to make sure that the HDL level is always above 60 mg per dilution. And if your HDL level is between 40 to 60 mg per dilution, you are at high borderline. And if the HDL level is below 40 mg per dilution, definitely you need to start your medication. The another type of cholesterol is LDL, which is actually the bad cholesterol, and this is the cholesterol that is responsible for the formation of plaque in the blood vessels, and this is the cholesterol which causes the blockage of the blood vessels, and it actually completely affects the functioning of the blood vessel as well as it affects the functioning of your heart. So the LDL level should be maintained. It should be less than 130 mg per dilution, and if you have a LDL between 130 to 159 mg per dilution, as I said, it is high borderline level, and a level 160 or above, then you need to definitely start your medication. Another important constituent that we see is triglyceride, and the triglyceride level, the desirable amount is less than 200 mg per dilution, and the borderline level is 200 to 399 mg per dilution. So if your triglyceride level is 400 or above, then definitely you need to start your medication. So once again, I'll just summarize at what levels you need to start your medication for an increased cholesterol. That is, if your total cholesterol is greater than 200 mg per dilution, or if your LDL is more than 160 or more than 160 mg per dilution, if your triglyceride level is 400 or more than 400 mg per dilution, or if your HDL level is 40 or below 40. Okay, then definitely you need to consider start taking the medication. I hope you have got an understanding regarding today's topic, and if you have any further queries, you can contact Dr. Aparna's Healthcare. You can leave a comment, and in the next video we'll be discussing what are the home remedies for lowering the cholesterol. So stay tuned for the next video. Thank you all.